Wish TV's Focus on Food is a commitment to improving food accessibility in the community. Hear from expert culinary contributors, health professionals, and people who are making a difference in the fight to eradicate hunger. Made possible by Indiana University Health.
Diabetes is a major public health concern, currently affecting more than 11% of the U.S. population. Adding too many numbers on there, Jennifer. Whew. Now, food insecurity, it's defined as limited access to food due to insufficient financial resources, and it is highly prevalent among individuals with diabetes. Aiming to alleviate the compounding effects of that cycle, IU Health had launched a diabetes pilot utilizing food as medicine to intervene on behalf of food insecure patients battling diabetes. With more on the pilot, we welcome Project Manager in Population Health Operations at IU Health. We've got Jennifer Bradley here. Jennifer, welcome to the show. This pilot program is going to do wonders. You guys have a lot of things planned for it. Tell us first how this came about.
Sure. So it started with us looking at the research, and what we were seeing is if you provide food that's specifically tailored for diabetes, it not only improves blood sugar control, but also is able to lower medical costs overall, which is astounding. So we took that and then we said, okay, let's take this research, see if we can put it into practice with our patients. Can we improve their blood sugar control? If so, how do we turn this into a long-term program that would be sustainable over time?
Now, the fun part about this program, from what I've researched, if my research is correct, you guys have a bunch of sessions that people can hop on and decide what they want to do. The first thing that I thought was really neat here is that you guys have a bunch of available time, so it's very flexible for patients to hop on and utilize the resources.
Sure, yeah. So part of our program is obviously the food. So we're delivering food directly to patients' doors, and not only for the patients, but for the whole household. So really taking a holistic approach that could be sustainable for that whole household to carry through. And then along with the food, we're also providing weekly consults with dietitians, and those are provided virtually, so it's really easy for access and can be done on the patient's schedule. And then in addition, those on-demand resources that you mentioned, we have a library of educational materials, cooking demos, and recipes. So we're really supporting them through the whole process as they learn to make those healthy lifestyle changes.
And talk about the importance of that support, because it's easy to just hand someone food and say, here you go, here's the recipes, here's the book.
Yeah.
But helping people really understand what they're taking in and how each calorie affects a different part of the body, and it can really make the difference between someone who is able to sustain and maintain good health with diabetes and people who maybe get progressively worse with this disease.
Yeah, excellent point. Yeah, and you know, you talk to your doctor in the doctor's office, you might have a quick 10 minutes, hey, you should be eating this, not that, and then you leave. It's really, really hard for anybody to make behavioral changes to impact your lifestyle, but definitely when you're feeling with the stress of a new diagnosis, if other things are going on and you just feel like you can't manage it. So what I love about our program is we started out with 2 weeks of ready-to-eat meals. So this takes all the pressure off the patient. They know exactly how much they should be eating. It's portion controlled. They're able to make that connection between I'm eating this way and I feel better, my blood sugar numbers are better. And then after those 2 weeks, we're transitioning to groceries. And throughout that process, you have these weekly check-ins with the dietitian, where the dietitian's saying, did you like that? Did you not like that? Well, how about we try this? Have you tried preparing it this way? So providing support to really carry the patient through and make those changes, not by themselves, but with the support around them.
Now talk to us about how easy it is for people to get involved in this. Like I just said, I was able to go on the website, look up so much stuff, and like I said, the Zoom links and all that good stuff, it's so easy to get enrolled. You have the contact info there. How do people get involved?
So at this point, you mentioned pilot program. So this was a pilot that we completed. We've had excellent results. So our primary outcome was A1C, which measures your blood sugar over the past 3 months. And if someone's not diabetic, you'd be at a 6.5 or lower. For someone who's well managed, you might be 7 to 8. And then for our pilot population, they started out at 9.9, and then they decreased to 8.6, which is fantastic. But I've still been following the patients, and even 9 months afterwards, they've decreased even more. So those results we're going to take and give them to our partners at Purdue University, do an analysis, and then based on those findings, we'll hopefully be able to find a long-term home for this program. But at this point right now, it was just a pilot.
Gotcha. Educational resources for the other things that are online that I looked up.
Yes, definitely.
So when it comes to the pilot program, any ideas on, maybe when we could see another one coming out?
I'm very hopeful by the end of this year or the start of next year.
Ooh, we like the sound of that.
Yeah.
Jennifer Bradley, thank you for popping
Thank
on
you.
and telling us all about this great program.
This is the Wish TV Focus on Food podcast, made possible by Indiana University Health. Find more on the Focus on Food website by visiting wishtv.com/food and watch the ongoing coverage on Wish TV.